Hi, my name is Laura Tamblin-Watts from the Canadian Centre for Elder Law and the National Initiative for Care of the Elderly.
My name is Dr. Natalie Archer, a dentist in Toronto, Canada, and owner of Archer Dental.
Today we're going to be talking on the issue of dental elder abuse and neglect. We're going to talk a little bit about advanced care planning as well. Who makes decisions for older adults, in what circumstance, and how do you know what to do? This webinar will have a number of hyperlinks attached to it, and we hope that you can follow along by using the materials that are linked to this webinar. The Dental Elder Abuse Response Project, or the D.E.A.R project, was a project funded by the federal government under the New Horizons for Seniors program and sponsored by the National Initiative for Care of the Elderly, as well as Archer Dental and the Canadian Centre for Elder Law. These groups came together to bring together the questions of dental and oral health for older adults with supports from the community and from the legal community to understand how these issues work together. Really, never before have some of the questions about advanced care planning been thought through around dental issues. And we're going to talk today about what is dental elder abuse and neglect, how can you recognize it, how can you prevent it, and how do you proactively plan to ensure that this doesn't happen to you or those that you love are taken care of. We have 3 workshop goals today. The first is we're going to answer the question, what is dental advanced care planning? Second, we're going to be looking at the tools that the D.E.A.R project has created to support you in working on an advanced care plan. And the third point is we're going to be working through some of those materials, and we're going to be looking at how you can use them and fill them out at home or in your workplace. So planning ahead for your teeth. Why? As we were engaged in this project, we found a lot of myths. Some of them are really that my family will know what I want. How often have we heard that, assuming that someone else will know what you want? It is a myth. People usually don't know what you want, and particularly may not be talking around issues of dental or oral health. People assume that you'll know who their dentist is. Well, what we've noticed is it's possible that you, in support of somebody else, like an older adult that you're helping, you may know who their doctor is, but it seems quite rare that people know who the dentist is. So never assume that someone will know who your dentist is or how to get in contact with them. There's often an assumption that you're going to get the same level of dental care or dental access in a long-term care facility or nursing home, or even in some type of supportive or assisted living facility. And what we know is very often people are not able to easily access the kind of services around oral health that they would want or indeed may expect. And we're going to talk a little bit today around how to make sure that that information gets put forward, but also understanding that you may actually have to be more proactive in reaching out to get the dental and oral health care that you deserve and need. People can be very confused about things like powers of attorney, and they're called different things in different jurisdictions. One of the big myths is, well, I've got a power of attorney, so I don't need to be thinking about dental advanced care planning. I've done those documents, and they'll just sort it out. Well, substitute decision-making documents, often called powers of attorney, really don't usually provide any guidance whatsoever in terms of dental and oral health. What they may do is provide somebody else with the ability to make a decision for you. And we're going to tease some of those issues out, talk a little bit about how powers of attorney are useful, sometimes how they can be abused or even just misused. And the last myth that we commonly come across is that people will assume that oral health, dental care is covered by some type of public benefits program in Canada. Maybe they think it's going to be covered by CPP, the Canadian Pension Plan, or OAS, the Old Age Security, or somehow will be covered by the provincial health insurance.
And I may add one point, and some people also assume within these long-term care facilities that dental care is being taken care of. Somebody's cleaning their teeth, somebody's taking care of those things, when really we're finding that that's actually a huge barrier. It's not happening right there.
It's a really important thing to assume that you can't assume anything in this area. And so what we hope is that this webinar will help provide you with some of the information and tools to really take control of this issue. I'm going to talk a little bit about why we're even talking about dental elder abuse and neglect. It's often not a term people know about. I remember about 10 or 20 years ago, people didn't really know what we talked about when we said elder abuse. What do we mean by that? Well, that conversation has kind of moved forward, and lots of people are now quite familiar with the idea of elder mistreatment. But the connection with dental care has only really recently been made, and there's a lot of surprises. Sometimes supporters or caregivers or family members may not prioritize oral health as important. And we know, in fact, and we're going to hear more about it, that the oral care needs of older adults is increase with age, not decrease. So we need to care more about it. It's important to note that, in Canada, we're a very multicultural and diverse country. And people come from all over, from different backgrounds, races, cultures, and value systems. And sometimes oral health has either not been available in the earlier years or has not necessarily been prioritized. As we move forward, we hope to support you in your learning in this area.
So I have some pictures of somebody's mouth up above, and Laura's got some pictures in below, but elder abuse can come in many different forms. Oftentimes, believe it or not, what I see as a dentist, especially doing any mobile geriatric dentistry or any nursing homes, is the mouth often gets forgotten. Nobody thinks of looking inside the mouth. Somebody's not eating. Somebody's losing weight. Who is opening somebody's mouth and looking often? The top picture is actually a lady where a lot of her teeth are broken. There was a huge abscess that brought her in, and I commended the nurses for doing that, and we took care of an abscess and took her out of pain. Laura, those are also real photos on the bottom.
And what we also know is that oral health is a major signifier of other forms of health and abuse. And so when we're looking at dental elder abuse and neglect, we are looking at it not just from a specific dental perspective, but also as part of a whole health perspective and the perspective of somebody living in the community. So when we're having a look in somebody's mouth, what we really are is having a look in part of their lives.
So what I'm going to talk about is the inspiration, I think, behind our D.E.A.R project, or the Dental Elder Abuse Response Program. As a dentist for over 10 years, practicing on a mobile basis and seeing a lot of geriatric patients or older adults in various different homes, long-term care facilities, retirement homes, I really got a sense of seeing a lot of patients and people that had no dental care. A lot of them had no access to regular preventative care and even just daily oral hygiene care. So the picture that you see in front of you is actually in our Runnymede location, which is a division of Archer Dental. And I'm very, very proud of this clinic. This is a special clinic located within the Runnymede Healthcare Hospital in Toronto, Canada. It's Canada's highest accreditation hospital, and this clinic is independently owned and operated. You see a Hoyer wheelchair lift, which is one of the devices that we use to be able to take patients in and out of our clinic there. And it's just a really happy, preventative, empowering place, and our focus is especially designed for seniors. Let's talk about the definition of what dental elder abuse and neglect really is. A lot of people say, what do you mean by, what is dental elder abuse? We've come up with this definition, and it's, I think, a really important concept to think about, because dental care, oral care, caring for your mouth is a necessary health care that oftentimes is forgotten for a number of reasons, or ignored, or not prioritized. But as a dentist, I can tell you that the mouth is your primary portal to your body. All that bacteria, anything inside the mouth, travels through the rest of the body. And so it's really, really important to keep it clean. If you're an older adult or a person that has difficulty caring for yourself, we depend on others. We depend on systems and guidelines and protocols to take care of ourselves. So this is what this project is all about, and bringing awareness and enlightening others to this important issue.